thank you very much for joining this CF Live, which is the pandemic in numbers and a run through of the latest report from the UK Cystic Fibrosis Registry. I'm Rebecca Cosgriff, I'm the Director of Data and Quality Improvement at the Cystic Fibrosis Trust, and I've had the pleasure of working at the Trust for the last 8 years, and I've got some other members of the registry team on hand on the call, including Dr. Siobhan Carr, who's a consultant paediatrician at the Royal Brompton Hospital and the clinical lead for the CF Registry, and also Susan Charman, who's our senior statistician and will be around for any questions that you might want to ask of her later on. So just to give you an outline of what we're going to be running through today, as I mentioned, I'm going to give an overview of the latest report from the UK Cystic Fibrosis Registry, and then Siobhan's going to say a few words about untangling two of the highs and lows of 2020, which is the introduction of Kaftrio to people with cystic fibrosis and of course COVID-19, which try as we might, we can't avoid needing to talk about. And then we'll have some opportunity for a Q&A, so please pop any questions that you have as we go along in the chat, and Belinda's kindly going to collate them together for us to go through at the end. And finally, Alan and Zoe are going to join us towards the end of the talk to discuss prioritising topics that really matter to people with cystic fibrosis and their families to focus on for research. So first of all, just a little bit of a recap in case everyone hasn't brushed up on what the UK CF Registry is ahead of this talk. So just a little bit of a reminder really that the registry is a consented database, so everyone who participates consents explicitly to be part of the database, which stores demographic, clinical care and health outcome data, and that includes the option to participate for everyone with cystic fibrosis at all 61 CF centres across the whole of the UK. And there's some kind of facts and stats on the screen there. It was founded in 1996, so it's been around for a while, and securely stores data, as I mentioned, from all CF centres across the whole of the country, and has incredibly high data accuracy and completeness, which is monitored by the team in collaboration with CF centres who contribute data. And it's really thanks to that huge enthusiasm for quality improvement and research that means that we collect really large volumes of data that help us answer important questions about cystic fibrosis. There is a question mark on the screen which someone's managed to highlight with red pen. I don't know, I have no idea how to even do that on Zoom, so well done to whoever managed to do that. The reason there's a question mark on the screen is because I wondered if any of you would care to guess in numeric values what that enthusiasm amounts to in terms of data entry points in a given year. So hopefully we'll manage to show a poll on the screen. If you're watching this recording back, you sadly won't be able to complete the poll, so sorry about that. But I wonder if you can guess in any 1 year, a 12-month period, how many data points are added to the Cystic Fibrosis Registry? Do you think it's around 1 million, 5 million, 10 million or 15 million? I don't know if I can guess. So I'll give you a few seconds to tot those up, and then Nicola, I think you're comparing the polls. We can see what people think. So hopefully you can see those results on the screen. Everyone was extremely optimistic about the enthusiasm that we have with the registry. So no one guessed 1 million. The most popular answer was 5 million, with exactly 50% of you thinking that was the number of data points that we got onto the registry. A few of you thinking 10, and 14% of you thinking it's 15 million. It's actually more than 15 million data points that are on the Cystic Fibrosis Registry every single year, which is well over 1,000 individual data points per person onto the registry every 12 months. So obviously that's a huge amount of effort in. What is the impact out? And I think the registry team are really very aware that it's incredibly important to maximize the impact of the data that are donated to us by people with cystic fibrosis and contributed by clinical teams. And we do that in 6 key ways. One of those is helping people with cystic fibrosis and their families to hopefully make informed decisions about cystic fibrosis, the care that they receive, the life choices that they make. We also try and give clinical teams the tools that they need to improve the quality of care that they can offer in cystic fibrosis centres. And another key element of the work that we do in the CF Registry team is to monitor the safety and the effectiveness of new medicines that are introduced for people with cystic fibrosis to be able to access. We also provide data for research to find the best ways of treating and beating cystic fibrosis. So there is an application process that's overseen by our registry research committee for anyone wanting to conduct research using registry data, so that it's available to clinical teams and researchers across the country and elsewhere if they've got an important question that can support improvements in CF care. And we also support commissioners in England to actually provide proportionate funding to cystic fibrosis centres to care for people with CF in a way that reflects the complexity of needs of their patients in that particular care setting. And we also support clinical trials. We do that in a few different ways. One is by helping potential study sponsors to conduct what's called feasibility analysis. And we do that in collaboration with the Clinical Trials Accelerator Platform team. Lorna from the CTAP team is on the call. But we also actually run 2 embedded clinical trials on the CF registry. One of those is called CF Start, and the other is called CF Storm, and collaborators on that, on both of those clinical trials, Siobhan and Alan are also with us on the call. Both of those are sponsored by Alder Hey Children's Hospital. So I'm going to focus now on the reports that we publish, and we do that on an annual basis. And just to give you a run through really of why we publish cystic fibrosis registry reports. One of them is really to try and tie together a few of those different objectives that we have for the registry that I just ran through. And our latest report was published last month in December 2021, and the eagle-eyed of you may have noticed that that's slightly later than we normally publish our registry reports. Ordinarily they come out in the summer. It was a little late this year, which was largely due to the impact of COVID-19, and we're hoping to be back on track for publication this summer of the 2021 data. So of course, the COVID ripple effect went much farther than just delaying the publication of our report. And one of the ways that it impacted life in 2020 was the delivery of cystic fibrosis care. And some of these are highlighted actually in the annual report itself. So due to things like shielding measures, avoiding aerosol producing procedures in a clinic environment, and service pressures meant that there were fewer face-to-face appointments than normal for people with cystic fibrosis. There was less testing of lung function and therefore less testing for specific lung infections. Some cystic fibrosis team members were diverted to COVID-19 care or elsewhere. There were more virtual appointments. These were obviously in place for some people in some CF centres pre-pandemic, but they definitely increased during 2020. And more home spirometry equipment was provided so that accurate virtual appointments could take place with the kind of data needed to back up the assessments. And what that meant really for the registry was that there were fewer data points, fewer encounters and fewer annual reviews to base our analysis off than normal. And what that really means as an overall outcome is that it can be a bit challenging to interpret the results, especially in the context of Kaftrio, which Siobhan has the unenviable job of trying to do a little bit later on. So one of the activities that we've supported throughout the year has actually been publishing up-to-date information on COVID-19 incidents. We didn't think that should wait for the annual report, so we've actually popped that on the website, sometimes at weekly intervals. At the current time, we're doing that at monthly intervals. It's available on the Cystic Fibrosis Trust website, and we promote that each time through our social media channels, so keep an eye out for that if you've not seen it. As I say, Siobhan's going to talk about this more later on, but I do hope that you found this information useful, that basically tells you how many cases we've detected amongst people with cystic fibrosis in a given month, and how many of those cases have resulted in hospitalisation. These data go up to the end of November because there is a little bit of a lag in data entry as clinical teams work on other things. We have seen an uptick in cases in December and January as a result of Omicron. But fortunately, the hospitalisation rate has actually been very low relative to the amount of cases that we've seen in December and January for this particular variant, and we'll be updating those figures in early February on the website, so keep an eye out for that. So one more poll, your second and final poll of the day, and moving on from COVID-19 just for a few minutes and on to guess what is the bread and butter of the UK CF Registry report. So for those of you that have looked at it before, you might be able to make a pretty good guess at this, but I wonder if you can estimate how many people with cystic fibrosis you think live in the whole of the UK. I'll give you a few seconds to select from the options. Okay, let's see what everyone said. Oh, absolutely perfect score from everybody. So for those people watching later who can't see the poll, the 100% of the people who responded correctly guessed that the number of people with cystic fibrosis is 10,837. Which you can see on this screen here. So that's the active patients that we have on the Cystic Fibrosis Registry for the year of 2020. And amongst those nearly 11,000 people with CF, we had nearly 10,000 annual review appointments recorded on the registry. And you can also see the breakdown of people with cystic fibrosis across Scotland, Wales, Northern Ireland and England on the map as well. And whilst that might seem like a pretty simple statistic to present as part of the annual report, it's actually really easy to underestimate how important it is to be able to say for a particular condition how many people live in a particular area of the UK. It's incredibly important, particularly when we're making arguments for reimbursing therapies like the CFTR modulators, to be able to very precisely say how many people will be impacted by that. So we can obviously delve into more detail than how many people with cystic fibrosis there are across the UK, and we can do that in a number of ways, one of which is looking at the ethnicity of people with cystic fibrosis living across the country. And it's really important that we're keeping an eye on things like this to make sure that the Cystic Fibrosis Trust strategy, for example, and our focus on developing support for highly effective therapies to be available for everyone with cystic fibrosis, that we keep an eye on how this changes over time. And what we can see across the last 10 years, from 2010 to 2020, is that although the vast majority of people with cystic fibrosis are reported as being white or Caucasian, that there are higher proportions each year of people who are from other backgrounds, and in particular Asian backgrounds. So one of the things that I think is a particular joy for the CF Registry team and colleagues at the Cystic Fibrosis Trust is that each year we publish data, we can see things improving for people with cystic fibrosis and moving in the right direction. And one of them is that we can see people with CF are living longer lives. And we can look at that pretty visually from the shape of the graphs that we produce. So the one that's on the screen at the moment is actually a historic graph, you can tell by the old school colour scheme, from 2008. And what you can see here is that actually back then we used to group together everyone aged 40 and over, because the numbers of people living into that age bracket was relatively small, so we would group it together. Whereas if we move forward to 2015, this is now, we'd started to actually expand those age groups, because there were more and more people living beyond their 40s and actually even into their 60s. And in the latest report for 2020, we can see that the number of people living into their 60s and beyond is higher than ever. So that's just a very positive shape of graph to be changing over time. And some other milestones that are really positive and hopeful to be able to report are around people with cystic fibrosis having families of their own. And whilst for many people with cystic fibrosis, having children can still be a very challenging thing, it's actually great to see that these numbers have been higher than ever for the last few years. And the Cystic Fibrosis Trust does actually have a pack specifically designed to provide information for anyone thinking about starting a family, which you can access on our website, or I'm sure we can dig out the link to put in the chat. The table below is actually showing the proportion of people who are in work or studying with cystic fibrosis. And although there actually is a disparity between men and women, so in the 2020 calendar year, 67.5% of men were in study or work, whereas that figure was 62.3% for females. It's really positive that those numbers are so high, and actually employment and life chances is a key element of the Cystic Fibrosis Trust strategy moving forward. So looking now to lung health, so this chart shows the mean lung function, or FEV% predicted, taken at annual review across the whole of the cystic fibrosis population. And it's not moving over time in years like some of the other charts, it's actually showing the age of each, the age cohorts in 2020 as a calendar year. And what you can see here is the yellow line shows data for 2010, the purple line shows 2015, and the kind of greyish blue line at the top shows the most recent data at 2020. And I guess the really positive thing to take away from that is that each year that line is getting higher and higher across each of the cohorts in the population. And one of the really positive things in terms of a key marker for 2020 specifically is that this is the first year where lung function hasn't dropped below 80% FEV percent predicted, which is often used as a kind of benchmark for good health for someone with cystic fibrosis, until we get to that 16 to 19 cohort, whereas previously that drop had happened in the 12 to 15 cohort. So really important milestones as we move through. And just a reminder really that those kind of lung function statistics are a really helpful way of guiding us about how things are changing for the overall cystic fibrosis population across the whole of the UK. But please do remember that if you're looking for something that feels a little bit kind of closer and more relevant to you or your friends and family, that there is a centre level analysis towards the back of the UK CF Registry report, where we kind of highlight key parameters, and you can look at where your individual centre statistics lie. So that includes things like prescribing rates for certain medications and of course lung function, which is the one that's shown on the screen there. So whilst, you know, a lot of the time we have the pleasure of reflecting really positive statistics, obviously not everything that we report on is always incredibly positive news, and obviously even non-COVID infection is still a really difficult fact of life for people with cystic fibrosis. As you can see from these statistics here, in the over 35% of people aged 16 and over with cystic fibrosis have Pseudomonas, which is chronic. And there's been a slight increase in the proportion of people who have non-tuberculous mycobacterium, or NTM, although the actual number of people with that infection is still relatively low compared to the whole population. And we've got nearly 14% of people reported with Aspergillus in the 2020 calendar year. So that is an area of focus for the research community as well as the Cystic Fibrosis Trust specifically. And one of those studies that I mentioned earlier that we run within the CF Registry, CF START, is actually specifically looking at how we treat and prevent Pseudomonas and Staph aureus, and that's the study sponsored by Alder Hay that Dr. Smith and Dr. Carr are both involved in. So the purpose of this slide really is only really to show you how busy a chart trying to map infection across different age brackets for people with cystic fibrosis is, and how complex the picture of infection that cystic fibrosis care teams and people with CF themselves are dealing with on a day-to-day basis. And that's really reflected by the way that CF teams and people with CF try and battle infections when they have them. And a key way to do that is by prescribing or taking IV antibiotics. And over 39% of people with cystic fibrosis in 2020 were prescribed IV antibiotics of some sort. But one of the changes that we've seen is the proportion of those antibiotics that are administered at home rather than in hospital. So of that 39% of people who needed IV antibiotics, 32% of those IV antibiotics were actually given at home, at least in part. And again, thinking about ways of staying as well as possible for as long as possible, a key way to do that is by taking inhaled therapy, but that does represent a pretty significant burden of care for people with CF and families. So we've got over 80% of the cystic fibrosis population taking at least one inhaled therapy, and over 25% of people are actually taking 3 or more inhaled therapies, which does represent significant burden. So of course, 2020 was a landmark year for CFTR modulator therapies, and we can see that people with CF and their clinical teams were in a real hurry to get started on these modulator therapies as soon as they were available. So we've got really, really impressive numbers recorded in this chart that maps prescribing of the different therapies during the 2020 calendar year, even though it was on the backdrop of a pandemic where obviously resources were scarce and services were under pressure. So this slide is to show lung transplant. This is a pretty dramatic change in lung transplant for the 2020 calendar year, and it might be something that Siobhan might wish to comment on. And that's that the total number of lung transplants that have taken place in the 2020 calendar year is much lower than we've seen previously. So that's 15 lung transplants in 2020 compared to 54 in 2019. So this is a really important element of the registry for us to keep an eye on moving forward, and to see whether that's kind of a one-off anomaly that might be associated with factors that relate to the pandemic, or whether it's something that is going to endure and might be more related to the introduction of Kaftrio, for example. And certainly anecdotally, clinical teams have reported to us that modulator therapy did mean in 2020 that fewer people with CF required a lung transplant. So finally, I'm going to talk a little bit about population level survival. So whilst this isn't directly applicable to individuals with cystic fibrosis, it can be a really good way to monitor changes over time, population-wide at a high level. And what we can see here again is that the improvements in care have consistently improved these statistics year on year all the way up to 2020, where we saw a smaller number of deaths amongst people with CF despite the pandemic, and a higher median age of death for those people who did pass away in the 2020 calendar year. So median predicted survival is another way of kind of talking about the same topic. It's a statistical technique that tries to use information about the past to make predictions about the future. And it intends to project the minimum age that we expect 50% of people born today to live to with cystic fibrosis. And we calculate these in 5-year age bands to try and avoid big swings in data that might be due to kind of chance changes in a single year. And it's another marker that, as I say, is steadily improving. And I've hidden the 2020 figure so that I can reveal that for the first time in 2020, that median predicted survival age has reached over 50 years old for people with cystic fibrosis here in the UK. And whilst that's still an incredibly young age, it's a really significant milestone for a condition that used to be a paediatric disease alone. So hopefully that's something that we can celebrate as a community, although another area of focus for us moving forward is looking at that disparity between survival, median predicted survival for men and women with cystic fibrosis. Because what we can see is that although the female predicted survival is increasing year on year, it's not doing so at quite the same rate as it is for men with cystic fibrosis. So that's my last slide. I'm going to hand over to Siobhan. Hopefully she's out there to talk a little bit about trying to untangle the COVID effect from the Kaftrio impact.
Hi, thank you very much, Rebecca, for that. I'm not going to talk for very long, and actually going to cheat a little bit in that the data I'm showing you is actually NHS England data. So they very kindly have helped us with some mapping of activity to try and help with improvement. And my remit was to just talk a little bit about sort of what happened with the pandemic, and also I know you're all aware of it, having lived through it. We saw a massive decrease in infections across all population groups, not just in cystic fibrosis, with everyone being locked down. So trying to untangle that sort of lockdown effect and the introduction of Kaftrio. So I don't know how you got those red lines on your slides, Rebecca. They're very weird. I'm just sort of, I was checking to see it wasn't me, but I don't think it was. This slide, just to explain, across the bottom, week 1 is from the 1st of January, and it goes along to, you can see week 51, I've arrowed at the bottom, second arrow where it says the new year. And the first lockdown happened in March, and you can see before then that I liked this grey line that we got sent. This is what all the hospitals did, and this didn't happen just across cystic fibrosis. This happened everywhere. We got edicts centrally to shut down everything and prepare for COVID. So you can see the hospitals cancelled a lot in this grey line of outpatient clinics, and you can see these are the outpatient attendances. What you'll find interesting, so pre-pandemic is the first 12 weeks on the left of that slide, dipped down, didn't complete. If you look on the right axis, it's actual numbers rather than the percent of the population. Bounced back up, has never regained. So the data here stops midway through last year in August, about 35th week. And you can see Christmas by the second arrow when we always cut down a bit. Bounced back, not quite to the same levels as pre-pandemic with the outpatients, if you look back. What the data doesn't tell us is the switch from face-to-face to video clinics. So it shows that we did well. People were still in contact, and I can speak from experience for some of my adult colleagues outside of the CF world. A lot of clinics, even for chronic illnesses, shut down completely and weren't offering the face-to-face that was available, or the videos that were available in CF very early on, and you can see it never completely stopped for CF. Rebecca, could I go to the next slide? Hooray, thank you. With my red lines at the bottom. So I'm now just going to show you the inpatient admission data, and I've basically superimposed 2019 data. So pre-pandemic, when we all didn't know what was coming, is in yellow at the top. In grey is 2020, and we're all very aware as the grey line dips down. We just talked about lockdown. And you can see it's number of patients. Again, I remind you, this is England, which is 85% of the CF UK population. So it's fairly representative. So you can see steadily across a year until about October, and pre-Christmas, there's a little bit of a dip. It's fairly steady. The number of people in hospital with cystic fibrosis in a given month is that yellow line. You can all see the pandemic effect. You know, we went from 1,400 down to 400 in April. It was pretty hard to get in. And you can see as we came out of lockdown on that grey line that we never went back up to the pre-pandemic admission numbers. This is admissions, and Rebecca's shown you IV days and home IVs. This data doesn't show that. However, if you look at the registry data, we had 44% of people with cystic fibrosis in 2019 had some IV antibiotics, whether at home or in hospital in that year. And if we look at the 2020 data for both hospital and home, it's less than 40%. I think it was 39%. So there's been a reduction. And the final one, just to show you here, is the purple line. We've only got data up till August. But you can see that we haven't regained anywhere near the pre-pandemic inpatient admissions. Again, that will be a bit higher, but we have to then factor in, if you look at the grey line, when Kaftrio came in, and you saw from Rebecca's graph that by the end of 2020, we had 2,700 people already on Kaftrio. And I think the data is beginning to show you that there's obviously an initial lockdown effect where we never got back to the full IVs, but I think the add-on effect of Kaftrio is beginning to show through from the next lot of data in the purple line. And that fits very well with the paper that Gary Connett and Ruth and the registry CF Trust team were involved with, where they were predicting what the effect of Kaftrio was likely to be, and it was up to a sort of 45–50% reduction in IVs, anything between about 20% and that. So I'm going to shut up there and pass this back.
Thanks very much, Siobhan. So we are going to move to a little bit of a Q&A if there are any questions from the chat. Belinda's going to compare us, I think, and there were a couple of questions that came in advance. So Belinda, if you're out there, do you want to quiz myself, Siobhan and Susan, who's also on the line?
Hi, good evening, everybody. So yes, we have got a few questions, so bear with me while I read them out. So the first question is there a long-term plan on how to monitor people with CF with COVID-19?
So I think that the really key thing is that people have conversations with their individual care teams, because the arrangements are different across different cystic fibrosis centres, and obviously there's going to be variation between adult and paediatric care as well in terms of how teams manage people specific to their particular health needs and the care configuration that's available in centres. But from the Cystic Fibrosis Trust perspective, we're definitely having ongoing conversations with the UK CF Medical Association. So that's a group made up of doctors who look after out to people with cystic fibrosis from all around the UK, that's supported by the kind of up-to-date, near to real-time data on COVID-19 severity and how many cases we're seeing across the UK, to try and make sure that clinicians are kind of armed with all of the information they possibly can be to adapt the way that care is delivered in line with the needs of people with CF. And Siobhan, you might want to come in and comment on your experiences.
No, I think you've said the same. I think different care centres and differences between paediatric and adults as how they're going to facilitate follow-up on outpatients going forward. We, within the registry, have adapted our data collection to try and cope with that, and have started to adapt how we collect where the encounter was, whether it was a video encounter, and also to try and collect whether the home spirometry that was sort of rolled out in a lot of centres post-pandemic and in some pre, how we capture that. So I think the information from NHS England anyway is that they're very keen for us to carry on having a lot of video interaction. They found it very exciting. I'm not sure that that's the groundswell on the in the majority of either clinicians or patients' viewpoints.
And actually, one of the programs that we're running across the whole country, supported by the Cystic Fibrosis Trust and in partnership with CF Centres, is to record what we call patient-reported experience measures. So that's a sort of semi-technical name that basically equates to surveys that people with cystic fibrosis and their families can fill in to tell us how they feel about the care that they're receiving. And that's some things that are questions that we would have been asking 10 years ago, which is things like, have you got access to a physiotherapist when you need one? But also some newer questions specifically targeted to evaluate things like video calls and whether they're in line with the preferences that people with CF have. So we're working on pushing out a couple of reports from both adult and paediatric services, and please do keep an eye out if you're asked to complete one of those surveys in your CF centre in future, that it really does help us to keep an eye on that national picture of how and whether things need to change or adapt.
I have another question that's been submitted ahead this evening, and they're all about the COVID infection rates. And so the question is, the numbers of people with COVID-19 infection are a lot lower than originally expected. Why do you think we see this?
Yeah, so it's an interesting topic to talk about, because I think whether and how we can get a really accurate picture of COVID-19 incidence is a really good question, and it's one that the answer varies over time. So at the very beginning of the pandemic, when we first started to monitor cases, the numbers were very, very low, which would have been in part because people with cystic fibrosis were doing a very good job of adhering to government guidance around shielding measures and protecting themselves from infection. But it might also have been to a certain extent because testing was more difficult to come by, and we wouldn't necessarily have in the CF registry heard about cases that were asymptomatic. And that might still be true, where asymptomatic cases either don't get tested as positive or they don't necessarily get reported to us. So when we're reporting on COVID, particularly for publication in journals, and when we're collaborating internationally, we tend to focus on the likelihood of a severe infection rather than trying to focus on recording incidence, because ultimately that's the really important factor that matters, is whether an infection results in kind of severe or long-term health outcomes or results in hospitalization. Siobhan?
Yeah, I was just going to add that the data we showed up to November, I think it was sort of 1 in 15 people with CF actually reported having had COVID by November. And I think the national data wasn't much higher than that. I think Rebecca's right. We've changed how we capture it now, and the Omicron surge may well mean we won't capture it quite so accurately anymore. But I don't, although it's low and shielding has done it, there were quite a lot of people that did get it in the end, if you don't look at the absolute number and work it out.
Your mention of the Omicron leads very nicely into the next question, Siobhan. So the question is the Omicron variant as much of a concern to people with CF as it displays differently in most people?
Yeah, it's another really good question, and you'll have noticed that the data that we're reporting at the moment only goes up to the end of November, whereas we really were expecting to see the Omicron variant reflected in data from December onwards. So it's a little bit of a case of keeping an eye out for our formal update to the website, which will come at the beginning of February. So that's just a couple of weeks away. But sort of informally on provisional data, we have seen an uptick in the number of cases being reported that we're assuming to be Omicron variant cases, although we don't actually receive that level of detail in the data. So we have seen a significant uptick in the number of cases reported, but fortunately not a corresponding increase in the amount of hospitalizations. So relatively speaking, hospitalization rates seem to be pretty low with this new variant, but that's something that we'll be able to confirm when we're more certain that we've got all the data, which does take a little bit of time. And Siobhan, you might want to comment as well.
No, I think that's fair enough. It's too early to say. I think we need to look at the original data and just remind people that the sort of global publications so far, as expected, it is very linked to your lung health prior to catching it. So more of a risk factor if you've got low lung function in the sort of severe range, sort of 40% and below. There is an age link, as there is in the general population. And we have seen in the latest global data of sort of over 1,500 people across the globe with a sort of a protective effect of the highly effective CFTR modulators. So the fact that NHS in the UK moved on with it was I think very beneficial.
Thanks, Siobhan. And I'm just conscious of making sure that Alan and Zoe have sufficient time to talk through their content. So what I might do is just pause questions for now. If you have asked a question that's not answered, we will get back to you either if there's a little bit of time at the end, or we'll get back to you in text on the chat, or I think we're able to follow up subsequent to the call anyway. So for now, thank you very much for your questions, and we will get to any that we didn't have the opportunity to answer. And thank you, Belinda, for helping to compare us. So I'm going to hand it over now to Alan and Zoe, who are going to talk through prioritising research questions for people with cystic fibrosis. Over to you, Alan.
Thanks very much, Becca, for that kind introduction. I hope that many people on the call will have seen our top 10 research priorities for clinical research in CF that we published in 2018. We're currently engaged in a refresh and update of these priorities, and I'm just posting the link to the update into the chat now because I'll forget to do it later on. But I'll also give you a QR code that you can use at the end of the talk. So these were the priorities that we published in 2018. They list research issues from simplifying treatment burden right through to eradicating Pseudomonas. And the critical thing about these research priorities were that they were developed collaboratively, involving people with CF, families of those people with CF, and also the healthcare professionals. Can I have the next slide, please? But you might not know how these were developed, and I'm going to touch on that very briefly. The James Lind Alliance is part of the National Institute for Health Research, and in many areas of clinical medicine, it has developed these top 10 research priorities. So everything from mental health through to coronary heart disease have been subject to these top 10, where patients and clinicians get together to agree what their priorities are. It's named after James Lind, who was an 18th century ship surgeon who did the first clinical trial, and he discovered the beneficial effects of citrus fruit in preventing scurvy from that. And over 100 of these JLA top 10s have been done since the process began. Next slide, please. We did our original survey through a series of, we did 2 surveys. One was to ask for potential research questions, and the second was to prioritize those questions. We had a terrific response to this, over 500 responses to each survey, over 1,000 questions, more than 20 different countries involved. But what really pleased us was half these responses were from the patient community and the other half from health professionals. So this really felt like a partnership. Next slide, please. And this is the schedule we set ourselves last time. We spent a year on this process from when we put together our steering group to when we had our final workshop. But I guess this begs the question of, did these research priorities make a difference? Next slide, please. So one of the things that we did was, before the top 10 priorities were published, we did a survey. And we looked at all ongoing research in CF that was happening around the world. And we compared those topics with what were the top 10 topics from James Lind. And we found that only about a third of the ongoing research worldwide mapped to one of the James Lind top 10 priorities. And we found also there was quite a disproportion. So, for example, there was a lot of work going on in adherence. I've put a box around that. There were 25 individual studies going on looking at ways of improving adherence, but there were only 2 studies going on looking at ways to treat non-tuberculous mycobacteria, or NTM. So first of all, the research community really wasn't focusing on what mattered to patients and clinicians. And secondly, when they did do, there was a big inequality, if you like, in the amount of effort that was going into some topics compared with others. Next slide, please. We also went into some of the James Lind top 10 questions that came from the community in a bit more detail. And I've highlighted those 4 questions here. They were questions about treatment burden, gastrointestinal symptoms, adherence, and physiotherapy versus exercise. And we wanted to know a bit more about those. So we did some further work where we went to the community and said, look, you've told us this is important to you. Can you tell us a bit more about what you meant? Because we wanted to make sure we were respectful of the message we were getting from the community, and we were really properly representing it in our research questions. Next slide, please. And there were some real insights from this work. I think some people on the call may have taken part in the survey. You may already be taking part in our refresh. And I want to thank you for that, because your contribution really has been worthwhile. And I believe it's really had an impact on resetting the research agenda in CF. But this is a comment from the parent of a child with CF. And it really struck me, and I find it really interesting, that they said there must be research on how to take things away. I hate it when new medicines come along now, because it means we have to do more stuff. We need more things coupled together. We need treatments prioritized for us. Next slide, please. So that's what we did. That's what the James Lind top 10 were. I've said that they showed that the global research effort wasn't really focused on patient and clinician priorities. What changes have the James Lind top 10 brought about? Has it made any difference? And there's a really useful piece that's on the CF Trust website, also on the NIHR website, a You Said We Did piece. And I've pulled a few key points from this, but the CF Trust alone has put £10 million of research funding to address James Lind top 10 priorities, and it's leveraged an additional 13 million of co-funding from other research funders. So I believe it has made a difference. I've also given some specific examples of important research that address some of the James Lind questions. So CF Storm, for example, an NIHR Health Technology Assessment Program funded trial running at the minute, £1.5 million, looks at stopping medications, reducing treatment burden, the point that was made by the parent in the slide I showed earlier. And this addresses number 1 in the James Lind top 10. And some work that we're doing in Nottingham, we're using magnetic resonance imaging. We've been given £1 million through a combination of the CF Trust, the CF Foundation in the US, and Vertex Pharmaceuticals to address this really important issue, James Lind question number 2, what causes gut symptoms and what can we do about it? Next slide, please. So why do we need to refresh this James Lind top 10? Well, 5 years have gone by since the top 10 questions were agreed. As I've mentioned, some of these top 10 questions are now being answered by large clinical studies. Many people with CF, but by no means all, have access to CFTR modulators, and that may have changed the priorities for that community. And finally, we've adapted to the pandemic. I think we now expect to do things differently. So more virtual visits, and we need to explore things like online randomization, online data collection. And we've had some good examples of studies that are doing that at the minute, like CF Storm. Next slide, please. So what's the plan? Next slide, please. Well, we opened our first survey last Thursday. The survey really asks very simple questions. The first one is, which of these James Lind top 10 research priorities do you think should still be in the top 10, which remain priorities? And secondly, can you suggest some new questions, some new priorities that should be considered? And we've been overwhelmed really with the response to this. Over 600 people have taken part since last Thursday in 5 days. That's more than we had for each of the surveys last time. So we're absolutely delighted with your response. Thank you to everyone who's taken part so far. Please tell your friends, use the QR code at the end and encourage others to do so. By the end of the summer, we hope to have a new top 10 list, which we're going to share widely. We published our first top 10 on Twitter as the final workshop closed. So we shared it with you as soon as we could, and we'll do the same again. And the really important work, I think, begins after that, is working with funders to bring further funding to CF research to address the priorities of people with CF and the clinical teams that look after them. Next slide, please. So thank you very much for listening. This QR code, if you want to take a picture with your mobile phone camera, will take you to the survey. So you'll get a flavor for what we're doing. And please do the survey, share this with everyone you know. We're very excited about this. And I'm also very happy to take questions. Thanks very much, everyone, for listening.
Hi, Alan. It's Lorna here. I'm just going to lead on a couple of questions that I think might come from our community around the research refresh. You've talked about the importance there of everybody giving their opinion, and we really want, excuse me, we really want to hear from everybody around the different elements of CF that might affect them. Can you give an indication of perhaps the variety of questions that were raised initially and how they'll actually go through that survey this time?
That's a really good question. We looked at the questions we got. I mentioned we had over 1,000, and we did look at whether we felt any of them had been adequately answered. And that said, there aren't a huge number of rock solid truths in CF care. So we did set aside some questions that we felt had been answered, and we put together questions that all addressed the same topic, and we tried to get a question which kind of encompassed everything. So there is a little bit of sifting and sorting that has to be done. What we want to do is present a manageable list to the community for the second round, which is not tell us what your questions are, but tell us which of these questions you think are most important. And last time we presented about 70. I think this time it might be rather less than that. But we do want people then to engage in telling us which of those questions are most important to them. We were delighted with the response last time, and some real insights for us. For us, the importance of gastrointestinal gut issues was a real revelation, and really redirected our research in many cases. So we're very interested to see what the response will be from the community this time.
Thank you. And, you know, obviously we've had the fantastic news that, you know, Kaftrio is available for many people, but there is still a proportion of the CF community that can't get access to Kaftrio or any of the other modulators. You know, they're just not suitable for them. And how can we ensure that their voices aren't lost in the responses that we get to the survey?
So we're very mindful of the whole ethic behind James Lind is that he who shouts loudest doesn't get what they want. It's really taking the pulse of the community and fairly representing smaller groups within the community whose voice needs to be heard. And I think that's definitely true of those who, unfortunately, at the minute, for one reason or other, can't take advantage of CFTR modulators. So we would really welcome responses from those individuals, and we want to represent those research ideas in the final version.
Lovely, thank you. So who are we actually looking to complete the survey? Who can take part?
Well, we had contributions last time from certainly primary school age kids, and indeed some of those questions found their way into the final top 10. So age is not a barrier, and you would expect me to say that as a pediatrician. So please, everyone engage. You don't have to be able to frame a formal scientific question to take part in this. Simply tell us what matters to you and what areas are really important to you, and we can frame that as a more scientific testable question later on down the track. But please don't anyone feel that there's a barrier to participation. We're keen to hear from everyone.
And does that include people in the UK only?
No, we've gone wider than that. So we had quite a big representation from North America last time. We're very keen to have European friends contribute this time, and we've translated the survey into most major European languages, and we've done that through SurveyMonkey. So we hope that colleagues in Europe and friends in Europe and patient community in Europe can take part.
Lovely, that's great. Thank you, Alan. I'm going to hand back to Rebecca to just close the session. Thank you.
Thanks so much, Lorna, and thank you very much, Alan, for joining us. And Zoe, I think you were helpfully posting links and things in the chat, so thank you so much for your support as well. And to Siobhan as well for taking us through that rather complex data. I'm glad you shouldered that burden for us. So it just remains for me to wrap up and say thank you very, very much for joining this session. I really hope that you found it useful and informative. If you have any follow-up questions, please don't hesitate to be in touch with us. You can reach us by social media, and there'll be routes to reach us available on the website as well. And just to let you know that the next CF Live event is going to be held on Wednesday, the 9th of February at the same time at 7 p.m. And that's going to be on money matters. So it's financial advice for students with cystic fibrosis is who it's targeted at. And that'll be our welfare and grants advisors sharing information about the support and advice that are available for students who are living with cystic fibrosis in studying in further and higher education as well. So please do join us if you'll find that helpful. And a final note, which is just to let you know that we are holding our FeBREWary event. I haven't actually got a cup of tea with me, criminally, to help promote it. So however you have your tea or your coffee or whatever your hot beverage of choice, please join us for FeBREWary as a fundraiser and help support people affected by cystic fibrosis. And there's plenty more information on that on our website and also on our social media channels as well. Or you can use the QR code if you're quick enough to grab it before we close the session. But thank you so much for joining you. It's lovely to see so many names and some familiar ones on the attendee list, and hope to see you all again soon. Thank you so much.